Hello, I'm Milonda Mitchell, Health Access Compliance Officer, and this is another installment of HealthAxis InFocus. As we approach 2025, a common question we hear is, what compliance risk should health plans prioritize as the healthcare regulatory landscape evolves, and the key compliance risks that health plans must prioritize to stay ahead? I see firsthand the importance of focusing on six critical areas: program integrity in Medicare and Medicaid, adherence to the Affordable Care Act and commercial plan requirements, including the No Surprises Act, privacy and interoperability, health equity, transparent member communication, and upcoming technical changes for calendar year 2025. Let's dive into each area to see why it's essential for compliance success. First, let's start with program integrity for Medicare and Medicaid. CMS is placing increasing emphasis on program integrity, fraud prevention, and quality metrics. Health plans need to be vigilant in monitoring billing practices, member eligibility, and adherence to medical necessity guidelines. Non-compliance in these areas can bring not only financial risk, but also impact star ratings and enrollment numbers. Prioritizing this means building robust auditing and monitoring systems that can adapt as new rules emerge, ensuring health plans stay ready for the intensified scrutiny surrounding these programs. Next, let's move to compliance for commercial and ACA plans, which includes adherence to the No Surprises Act. This act protects members from unexpected medical bills, especially from out-of-network providers in emergency or non-emergency situations where the patient has limited control. Health plans need to establish processes that ensure transparency in billing and cost-sharing information. Compliance in this area means rigorous network management and proactive provider communication to minimize surprise billing instances and ensure members understand their costs upfront. Our third key focus area is privacy, cybersecurity, and interoperability. With the healthcare sector rapidly digitizing and the CMS Interoperability and Patient Access Final Rule in full effect, health plans must allow patients access to their health data through secure, standardized APIs. This empowers patients to make informed decisions, but also demands that health plans meet HIPAA requirements and prevent unauthorized data access. Investing in advanced data security and interoperability technology is crucial to protect patient information and comply with both federal and state level privacy regulations. Now, let's discuss health equity and social determinants of health, which have become central compliance areas as regulators emphasize equitable access to care. For Medicare and Medicaid populations, CMS has introduced mandates requiring health equity metrics reporting, and similar expectations are extending to commercial plans. Addressing these social determinants isn't just about avoiding penalties, it's about remaining competitive in a market that values equitable and accessible care. Health plans should consider programs or partnerships that can reduce disparities and improve access for all members. Moving on to our fifth area, let's talk about operational transparency and member communication. Health plans face growing obligations to provide clear, timely information to members about their coverage and benefits, especially regarding prior authorizations, denials, and any cost-sharing requirements under the No Surprises Act. Failure to meet these requirements can lead to significant penalties, so it's essential to invest in consistent, accessible member communications to ensure compliance and foster trust with members. Finally, let's discuss the technical changes coming for calendar year 2025, which will significantly impact health plan operations and compliance. These updates are anticipated to include refinements to risk adjustment methodologies, changes to quality measure reporting, and new data submission standards, all aimed at increasing transparency and accuracy. Health plans must start preparing now by upgrading systems to handle these data collection and reporting requirements. In addition, with the 2025 focus on better data integration, interoperability requirements will likely expand to include even more comprehensive data sharing capabilities. Health plans should collaborate with technology vendors and invest in infrastructure upgrades to ensure they're ready for a seamless transition when these new requirements take effect. Thank you for listening. Compliance is not just about meeting regulatory obligations. It's about delivering reliable, equitable healthcare that meets the needs of all of our members. Let's keep that commitment at the forefront as we navigate these changes together.